How much does it cost to have celiac disease? Living with celiac disease involves not only a change in eating habits, but also a direct impact on the pocketbook. People with celiac disease must follow a strict gluten-free diet for life to avoid intestinal damage and health complications. But how much does it really cost to have celiac disease per year? What is celiac disease? Celiac disease is an autoimmune disease in which the body reacts to gluten, a protein found in cereals such as wheat, barley and rye. To control the disease, the only effective option is to completely eliminate gluten from the diet. This forces patients to purchase specific gluten-free products, which are often significantly more expensive than their traditional versions. Annual economic cost of the gluten-free diet. Gluten-free products can cost 2 to 4 times more than conventional products. Below is a breakdown of typical annual cost estimates for a person with celiac disease. 1. Basic gluten-free food. Gluten-free bread, $200 or $300 per year. Gluten-free pasta, $100 or $150 per year. Gluten-free cookies, cereals and snacks, $300 or $500. Special flours, baking mixes, etc., $150 or $250. Extra per year on gluten-free commodities only, $750 or $1,200. 2. Risks of cross-contamination. Many celiacs must buy certified products, which reduces options and raises prices. They also invest in separate utensils or new appliances, such as toasters. Cost of utensils or exclusive kitchenware, $50 or $150 initial. Safe cleaning products, $40 or $60 per year. Annual extra for pollution prevention, $50 or $100. 3. Eating out. Dining out or eating in restaurants is a challenge for celiacs. Often, gluten-free menus are more expensive, and options are limited. Restaurants and cafes, average extra cost of $3 or $5 per meal. Estimating 2 outings per month, $75 or $120 per year. 4. Limited availability and online purchases. Many specific gluten-free products are only available in specialized stores or through the internet, with shipping costs included. Extra costs for transport, shipping or herbalist purchases, $100 or $150 per year. 5. Supplements and medical controls. Although not all celiacs need them, some require vitamins, analyses or specific controls that are not always covered by the public health system. Private analytical or nutritional controls, $100 or $200. Vitamin supplements, iron, vitamin D, etc., $60 or $100. Estimated annual total for a person with celiac disease, between $1,075 and $1,770 per annum, it's their aid in Spain. In countries such as Spain, the gluten-free diet is not subsidized by the public health system, unlike in other European nations such as Italy, where celiac patients receive monthly vouchers for gluten-free foods. Some autonomous communities offer minimal tax deductions, but in practice, the cost falls entirely on the celiac person or his or her family. Is there help in Italy? It is one of the most advanced countries in supporting people with celiac disease. The public health system offers a monthly voucher, between $70 and $130, to buy gluten-free products, depending on age and region. In addition, gluten-free foods are widely available in pharmacies and supermarkets. And in the United Kingdom, the NHS, public health system, used to provide gluten-free foods by prescription, although in many regions this has been reduced. Some areas still offer certain products free of charge to diagnosed patients, especially the elderly or those on low incomes. And in the United States, there are no direct government subsidies for celiacs, but gluten-free products can be deducted as a medical expense on tax returns, if there is a confirmed diagnosis. In addition, gluten-free labeling is regulated by the FDA, which makes shopping easier. And in Mexico, there is currently no direct state aid for celiacs. Access to gluten-free products is still limited in some regions, and prices are higher. There are associations that promote awareness and provide guidance to families, but there is no financial coverage. And in Canada, celiac patients can deduct the extra cost of gluten-free foods compared to their conventional counterparts on their tax return. It is necessary to keep a detailed record of expenses. Conclusion? Being celiac in 2025 can cost up to an additional $1,700 per year, simply by having to adapt the diet and buy specific products. Added to this are the social challenges, travel constraints and the constant effort to avoid cross-contamination. Although product offerings have grown and improved, the price of gluten-free remains a significant economic barrier, especially for families with more than one celiac member. Strengthening public support policies and reducing the price gap remains a pending challenge in many countries.